Great. Thanks again for joining. My name is Kate Morars. I'm the Deputy Director of Public Health at the Hepatitis B Foundation and Director of Hep United. Thank you for joining the Community Health Center Learning Collaborative. This is an information session about a new learning collaborative that we are starting that is going to be focused on hepatitis B. This is a program that we are partnering with the Association of Asian Pacific Community Health Organizations, APCHO. And I'm joined today by my colleagues, Shreya Koirala, the Public Health Program Coordinator at the Hepatitis B Foundation, and Evelyn Mua, who is an Associate Director with APCHO. And we are going to be bouncing around the mic today and co-hosting this session. So I'm going to go ahead and turn it over to Shreya.
Hi, everybody. Welcome. So today's session is aimed at providing you information about the Learning Collaborative which we are planning to host later in the year, early 2023. Some of the areas that we will cover today are, first of all, introducing everybody, and then we'll go through the overview of the Learning Collaborative, what we are thinking how it should look like and things like that. Then we'll discuss potential curriculum and topic of interest. At the end of the session, we will be welcoming any questions you would have. You can either unmute yourself to ask the question to us, or you could write it in the chat. We would also want you to introduce yourself. So please feel free to tell us your name, title, and organization, and the location through the chat box. And I will also be launching a poll question very soon. The poll question will ask you which organization you represent. So please let us know what organization which organization you're representing. So I'm just going to launch the poll now. Just a few more seconds and I'll close the poll. Thank you for answering that. It seems like we have people from different types of organizations. We have folks from national organization, community-based organization, and state or local health department. Thank you so much for joining, and we can get started now.
All right, well, I will start off with a quick background about the Learning Collaborative and its goals. So this Hepatitis B Learning Collaborative is a project that is supported by the CDC Cooperative Agreement that's focused on building the capacity of organizations and our coalition through Hep United to improve hepatitis B prevention and treatment services. The Hepatitis B Community Health Center Learning Collaborative is focused specifically on improving the capacity of community health centers or public health clinics, for example. And Evelyn is going to go more on, share more about the intended participants later. But the overall goal of the program is to improve the capacity of community health centers to provide hepatitis B services. So everything from education to screening to management programs. And we're hoping to foster a cohort of health centers that serve a diverse population with a focus on Asian Americans, African immigrant populations, Native Hawaiian and Pacific Islanders, and those who serve people who use drugs as well. And then the project will be, we are going to be developing a curriculum, and that format will be both based on theory, and as well as focusing on individual capacity and readiness to implement hepatitis B services. So this will be in a virtual group learning series. Our plan is for the format to be, the sessions to be held twice a year. So these will be 4-week sessions. The sessions will be held once a week for 4 weeks. And then depending on the time of year, and we'll be taking a poll for those of you who are interested in participating about what time of the year would work best. We will also be using a learning management system. So for example, things like Google Site or Idlum Wall, if you've heard of it, as a forum for archiving the curriculum and assignments and things like that, and being able to connect with other participants that are part of the Learning Collaborative. And the Learning Collaborative will be facilitated by one of our organizations that will be hosting the sessions at each, during both of the 4-week sessions.
So we would want people who are registered for the Learning Collaborative to attend every session. Our aim with the Learning Collaborative is that people take away information about hepatitis B and use it to implement a Hep B related program for their organization or community. And for that, it would be important to attend every session. We would also like everybody who's registered to be on time and respect everybody's time and what we're trying to achieve with the Learning Collaborative. We will also be handing out assignments after every session. So we would generally expect everybody who's registered to complete their assignments on time. We will also have guest speakers attend every session, and these will be professionals who have been working in the field of Hep B, and they will be invited to present on their area of expertise. For example, if we are having a session about perinatal transmission of Hep B from mother to child, we will invite somebody who has expertise in that area. We are hoping to have our first session early 2023, but we would also like to know from you what time of the year works best for you. I'm going to launch another poll question, which is going to ask you that, and your replies are going to help us plan this a little bit better. Give me 1 second, I'm just launching the poll now. I'll give it a few more seconds before ending the poll. So we have around 57% of people who would want the session to be held in summer, June, July, or August, which is followed by 43% of people wanting the session to be in fall, and we have 29% people wanting it to be held in spring. We will take this into consideration, and we will try to figure out a time that works best for most of you. Thank you so much for answering that. Moving on, 1 second.
Thanks, Shreya. So for this Learning Collaborative, the intended audience are health centers, health center lookalikes, and other community health organizations serving Asian American, Native Hawaiian, Pacific Islander, and African communities, and or people who use drugs. Also, for those who are interested and or invested in implementing hepatitis B education, screening, vaccination, and linkage to care programs, and promoting cross-sector partnerships with community-based organizations. Before we discuss the potential curriculum for this learning collaborative, we'd like to learn what topics you're interested in. So Shreya will launch the third poll. And please identify the topics in the poll, as well as if there are any other additional topics, please send it through the chat. And Shreya, feel free to end it when we have enough respondents.
Yeah, a couple more seconds and I'm going to end the poll.
Thank you. So it looks like there's 80% for the first two choices. So establishing a health center-based hepatitis B education and outreach program for patients in local communities, as well as integrating universal hepatitis B screening and vaccination into your healthcare system. Following immediately that, just by 10% less, by 70% of folks here, preventing perinatal hepatitis B transmission. And then 30% are interested in managing patients with chronic hepatitis B infection. I also see one more came through the chat. Thank you, Thaddeus. Funding services for uninsurable patients. Okay, so thank you very much. We'll take those topics into consideration for determining the topic for this learning collaborative. Lastly, we can move on to give you a preview about the curriculum we are considering for this learning collaborative. The curriculum is modeled after the one that is used in the two previous learning collaboratives hosted through the TB Elimination Alliance, as well as the ones from APCHO. The first is learning from subject matter experts about their challenges, best practices, and peer-to-peer learning. The second is a fishbone diagram and developing smart solutions. In the fishbone diagram, there's a clear problem statement that's identified and then main causes to describe the problem. These connect to the backbone, so in the rib section, and then contributing factors for each cause are also identified and connected to the ribs. And then to guide this tool, we also use the root cause analysis to explore the sources and the problems and asking the 5 whys to understanding the specific problem about an intervention or a challenge. And then this helps separate the problem's content from its history and allows for consensus around the problem and its causes. So that wraps up the suggested curriculums, and we're still exploring what we may use for this upcoming learning collaborative. Yes, we would like to turn it over to you all if you have any questions. Feel free to unmute yourself or send your question through chat. Or also raise your hand. Okay, seeing that there are no questions, if anything does come up, if you have any questions, feel free to contact us. Is there an email that we can give everyone to reach us at following this info session?
Yeah, if you have any questions, please feel free to send them to connect@hepunited.org, and I'll drop that into the chat right now. And we're happy to take your questions. And I also wanted to add, given that the intended participants of this learning collaborative will be community health centers or federally qualified health centers or FQHC lookalikes and public health clinics as well. If you're joining from a health department, please do share with your colleagues who are from those types of organizations. We would greatly appreciate it because obviously some of you may already be working really deeply in the hepatitis B world. And we are trying to look for those that are in the early stages or aren't as familiar with hepatitis B and are interested in adding hepatitis B as a service into their program. Or if you would just like to improve your capacity in certain areas or know of any organizations that are providing direct services that are looking to improve their capacity to provide hepatitis B services, please do share this info session. The slides we'll share afterwards, as well as a copy of the recording. And then we'll also be in touch with everyone that registered and attended today. Be on the lookout for more information as we finalize the curriculum and the training topics. And also the time of the year that you shared was really helpful. And we'll keep that in mind as we look at the time frame for implementation within the next year. Great. Evelyn or Sharia, did you want to add anything else?
Just that we'll be in touch, so keep a lookout on more information about the Learning Collaborative session. We'll be sharing more as we finalize more details about it. And thank you so much, everybody, for attending today. Your responses are really helpful to us, and we hope we can plan something that's really useful for everybody.
Great. Thank you so much for joining, and have a great day, everyone.